Good evening, everyone. Good evening, pharmacists. And good evening, if you're a farm tech, good evening to you too. Maybe you will learn something today. Pharmacists, welcome to the first of what I believe is going to be a journey to a very exciting conference next year. We are all set. Today is the first of a series of webinars that we will be holding between now and June, hoping to digitally engage those of you as we work towards an in-person, very exciting conference in June of 2024. We're going to share the save the date poster for the conference. Next year's conference is going to be held at Sarowa White Sands. As members requested, it is going to be on the North Coast. And we are working towards having guests from all over East Africa, a few people from outside of East Africa, within Africa. And also we're going to have guests from North America and Europe as well. We're looking to partner with ISPE at the conference. And also we will have FIP in attendance at the conference next year. The plan is to have a 5-day conference comprising of a 2-day pre-conference and mostly geared towards teaching about pharmacoepidemiology and related fields. And then we go on to the main conference, which will be 3 days, the Wednesday, Thursday, and Friday, with a lot of opportunity for networking, a lot of opportunity for building your career, and also a lot of opportunity to learn. We are, for the first time in PSK's history, going to be using the Oxford Abstracts software, and we will be going through various aspects of that software as we go along. Today's presentation will focus on how to submit an abstract on Oxford Abstracts, and we will then have later sessions on how to register on Oxford Abstracts and how to interact on and network on Oxford Abstracts as well as we go along and come closer to the conference. I want to thank our team, our conference organizing team. It comprises of Dr. Ermias, who is going to be speaking today. Dr. Sylvia is the co-chair. She's also going to be speaking today. Dr. Anne Mercy is also going to be speaking today. She's also part of the conference team. We have other members of our team who will be introduced as we go along. We also have a guest joining us from Nigeria called Joseph, and he will introduce himself when it comes to the time. Welcome, Joseph, to PSK's webinar. And with those few opening remarks, we also want to thank the Secretariat and the team with Hezron for putting this together. So I think with those few opening remarks, I can now hand over to Dr. Ermias to take the program forward. If you have any questions, please share them on the Q&A tab or leave them to the end. We will take them as we go along. Thank you so much.
Thank you very much, Dr. Anis. Before my presentation, let me invite Dr. Sylvia Opanga to give a brief about the theme and sub-theme of the conference. Dr. Opanga.
Thank you very much, everyone, for attending this. I like the participation. We are very many, and it's very exciting that we are hosting an international conference together with the International Society for Pharmacoepidemiology, together with FIP also coming in attendance. So we hope This will be a very exciting conference coming on the backdrop of PSK celebrating 60 years. So we have come up with a theme and sub-themes for the conference. So Hezron, if you could just share that with me so that I can go through it with members and we highlight the key aspects. So as Hezron shares, what I would like to say is that we are planning the conference. We are in high gear and it's going to be very exciting. We also have our colleagues from the International Society for Pharmacoepidemiology who will be joining us for the pre-conference as well as the scientific committee to plan and just make sure all the abstracts are good. We have high quality scientific presentations and the conference is very exciting. Hezron, kindly just share the presentation that has the theme and sub-themes of the conference. So you can just zoom in a little bit so that we can see it nicely. You can see we have a very nice call for abstracts. So we'll be doing this. We are sending out this together with the International Society for Pharmacoepidemiology. As PSK, we have come up with a theme called Pharmacists Transforming Policy, Practice, and Patient Safety. And we look forward for ISP's contribution on this. We have very many categories for submission, and we came up with these categories or sub-themes so that we can include pharmacists and other healthcare workers who have different areas of specialization or different areas of interest. So one of the areas we'll be looking at for abstract submissions will be the regulatory space, which can include regulatory affairs as well as regulatory pharmacoepidemiology. We shall be looking to get abstracts and presentations in the pharmaceutical manufacturing space, pharmacoepidemiology and pharmacovigilance, toxicology and substance abuse, pharmacoeconomics, as well as policy and advocacy. So we'll also be looking at the relevant laws and policies that affect our practice as we gear towards transforming policy, practice, and patient safety. We'll look at hospital, clinical pharmacy, and radio pharmacy. We'll also have presentations in academia, research and development, which encompass aspects of both pharmacy and pharmacoepidemiology. We'll look at universal healthcare and how both pharmacy and pharmacoepidemiology tie in. We'll look at community practice, as well as the upcoming areas. We are also trying to be very innovative. So we would like presentations as well in the digital health and artificial intelligence, as well as mental health. And then we'll be looking at special populations as healthcare workers, as pharmacists, as pharmacoepidemiologists. How do we take care of special populations like pregnancy, pediatrics, and geriatrics? What should we focus on, and how do we specialize in these areas? Because these populations have very unique drug-related needs, and we would like presentations to be sent on those areas. We shall also look at medical devices and technologies, including the pharmacoepi aspects of those. And we shall also look at innovations in training and building a future-ready pharmacist workforce. So as we are looking at this, how are we innovating to improve our practice? We also have public and global health aspects, as well as supply chain logistics. And then we'll also look at complementary, alternative, and herbal medicine, which is an area that African healthcare workers really, it's a very important area for us and our patients. And how do we come up with, how do we get that data? How do we come up with policies to influence that area of practice. So we really look forward to your participation. So feel free to send an abstract, feel free to participate in an area that you're interested in. And I can assure you that we'll also come and learn both from our local and international experts. So I will stop there and hand over to Dr. Ermias to take us through the next session. Thank you very much.
Thank you very much, Dr. Sylvia, for that brief on the team and sub-team. Good evening, colleagues, seniors, and young pharmacists. For those who don't know my face, I'll put my video for a few. Okay, I think it is maybe Hezron, you can enable it, but in the meantime, let me share my screen and I take you through what this discussion is all about. So I'm Ermias Magia Tarafe, and I'm a pharmacologist and pharmacist, and I'm so proud to be part of this very vibrant team of the conference organizing committee. I work at USIU as an assistant professor of pharmacology. So today what I'll be doing will be very brief to share an experience from research and from supervision of a number of undergraduate and postgraduate students on writing research, writing an abstract. But I'll start my talk. Usually I love interacting with the students, and this one is very difficult. But I need to engage everyone for a brief minute to share your experience. Have you previously submitted or presented an abstract in a conference? I wish everyone to take 2 minutes and to put your experience on the chat. What was your experience? How was it? And hope Hezron will be able to read that one and to tell us. But I'll give like a minute or two to everyone. How was your experience? Maybe the last PSK conference, another international conference. How was it? I can see Susan is saying not at all. Okay, so this may be a good time. We can, oh, sorry, I got a rejection. Rejection is one of a result for sure. This is Dr. Anne Mercy. This time, hope you'll submit, and we look to see, to help you to also provide mentorship so that a number of young pharmacists will be able to submit their abstract and get accepted. So writing a research project is very common. I'm sure most of you here at undergraduate, you have done a bit of survey or experimental study, so you have your paper. Others who've completed their masters, you have your thesis. So it is a process of bringing everything together. Either you try to look for publishing it in a peer-reviewed journal, or this is a very good opportunity for those who have never submitted or presented, because as Dr. Sylvia mentioned, this will be an international conference. All abstracts will be subjected to a peer review, but at the end of the day, you will have a peer-reviewed conference proceeding, which will be a big plus. So in my talk, I'll try to answer the following points. What did the conference abstract? Is it really important on top of you going to a conference and presenting what is the relevance and what are the key elements of an effective abstract? So basically, we can say that abstract is a summary, is a brief summary of your overall research project or scientific paper, which follows a certain format. So any reader, without reading the whole paper, maybe it could be 10, 20 pages, should be able to understand the essence of your work by reading around maximum 350 words of your abstract. That is the essence. It can give the readers what your research is all about. So usually reviewers first, I'm also a reviewer for more than near to 20 international journals. And the first thing I usually do is just to read an abstract. So because the abstract speaks everything. So what is it in this abstract? Let me give you a summary and I'll go deep. We can capture the following 4 C's of a very good modality or way to write an abstract. It should be complete, it should be concise, clear, and it should be speaking smoothly, the same thing from the introduction to the conclusion. Let's get deep into it. What are the key elements? The first thing in an effective abstract is to have clarity and conciseness. What do you mean by this one? In your abstract, you should be able to communicate your research clearly. And we don't need a lot of technical terms, definitions, or citations on the abstract. It should be very clear to the reader. Imagine you are having 350 words, so you can't have a lot of information in that few space. The other thing is also it should be relevant to the conference theme. So now you can see in this year, we are really focusing to see the role of pharmacists, or we need to see pharmacists transforming policies, practice. So how is your work inclined or aligned to the theme of the conference? You could have an experimental work. Yes, that experimental work can touch on practice, can touch on policy, can touch on patient safety. So the write-up should be geared towards showing the connection toward that big picture. The other point of a key element in effective abstract writing is the structure. So I'll explain shortly that the abstract should be prepared in a certain structure. It should have a title. There should be details about the author. There should be an information in background, the method, what are the procedures you used, the methods you followed. Finally, what are the findings and what is the conclusion which we can draw from that work? So these four key elements, the clarity, the structure, the relevance to the theme, and finally having a strong opening and closing statements could make an abstract to be very effective. As earlier depicted, now we expect abstracts to be submitted for this conference to have the following flow. Let me speak one by one. The first thing, for example, before I talk about the detail, look this abstract. This is one of the abstract which was published in the previous and the 41st PSK Annual Scientific Conference. This is, I think, the 2020s. So you can see this paper, the author, you can see the topic. This is by Dr. Patel. So it has a background, briefly explaining what is the basic thing, what is the problem. Then it comes down here to the objective, okay? The objective is here, okay? And you can see the detail of the methodology briefly explained. It is a cross-sectional study design, the number of study subjects, in this case, it is prescription papers, the duration of study, including finally, you can see the result and conclusion clearly being depicted. So what do we have in an abstract? The first thing, we start by writing the background. Maybe it could be 2 statements or 3 statements, but briefing the general aspect of the topic. This is an inverted triangle. Then you bring it specific towards your topic. It's important to show why that research is relevant. And then you link it towards the objective or towards the method of your work. In the second part is the abstract should clearly inform readers about the method. How was the study conducted? This is very important because other authors will be interested to replicate your study. That is the key point in research when we talk of validity and reliability. So in your method part, indicate the study design, what type of sampling technique was used, whether you have some specific inclusion and exclusion criteria should be indicated. Ethical statement, okay? If it is an experimental study, also, what type of experimental protocol have you used? Maybe equipment, if it is an extraction process, if it is data collection, the same, the data collection protocol, everything should be summarized briefly. Look, for example, another abstract this is from the last year's conference proceeding. Let's see. This one has what we call, you can see the background. Maybe it is too small to be seen, but I'm sure you can be able to pick it. The abstract contains the background, general overview, you can see, because this paper talks about antibacterial use practice in Kenyan healthcare facilities. So the background talks about antimicrobials, misuse, then it dives into the objective, specifically speaking, what this research is all about. Then when you come to the method, as we talked, it talks specific. What is this method? It's a point prevalence survey. The study site was clear. It talks about the population that was interviewed. It was very clear. Finally, you can see the result. What are the findings? So an abstract should not stop on the finding. Rather, we need to have a conclusion. So what makes this one different from the routine thesis paper, which will have a discussion? Here in abstract, we don't have a discussion. Just we put the finding, then what is the conclusion? What is the message you're having for maybe for policymakers? Okay, what is the home take message for the society, for regulators? That is now what will be captured under the result discussion. So a short description of key findings should be there. This result should also be connected to the final conclusion you're planning to draw. Okay, what are you going to show us? Is it policy direction? Is it future direction? Maybe you can pose a research question so someone else can pick it up. So in summary, an abstract should have a background, an objective, a methodology, result, and the conclusion component. And finally, the keywords, because the keywords will really help in searching, in online searching. For example, if you type antimicrobial, for sure you can easily pick this abstract from search engines. If you talk about point prevalence survey, if you Google, then directly your abstract can easily be picked by search engines. That is the advantage of keywords. So we advise you to have at least 5 keywords in your abstract. So to give some tips and to summarize my presentation, there are some mistakes to avoid. For example, there is no need of putting, for example, citation on the abstract. There is no need of discussing your findings with other previously done paper, okay? Too much detail is not important. So the best thing that is advised is read your paper. From your introduction part, have two statements. Go to your methodology, pick 2 statements. From your result, what are the core results of your finding? What are the core findings which you need to talk about it in that short paragraph? That is the key point here. I think I've also talked about this one. So you can talk with mentors for guidance. We are available to provide also support for those who need to prepare. Even after submission, if there are some incomplete submissions, later on I'll talk, the same will be reverted back to the authors. So abstract could be submitted in 2 modalities. You can prepare your abstract, and then you can decide whether to present or to submit that abstract in a form of oral presentation, which is face-to-face during the conference, or as a poster presentation. So then once your abstract is accepted, then you'll be notified whether you can come for oral presentation or to share it on poster. I need to talk of the following key process we follow after submission of an abstract. So the first step, as of today, we'll start receiving your abstract till the deadline is 2nd of April. In the meantime, during the process, your abstract will be checked frequently as submissions come in for completeness. So what do we mean by completeness? A complete abstract, as I mentioned earlier, should have the title of the abstract, the details of all the authors. Later on, Dr. Mercy will talk about it. It should have the title and the whole abstract prepared in a standard structure. And I've mentioned our structures that goes from background, objective, goes methodology, result finding, and finally, conclusion and keywords. If one is missed, we refer it as an incomplete submission, which will be reverted back to the authors for correction. Then once they correct you'll be guided, then again it can be resubmitted. Then all abstracts will be subjected to a peer review process. This is an international conference, so we have expert reviewers from PSK and ISPE. So the reviewers will be given the whole of April for purpose of reviewing. Then finally, you'll be given a feedback whether your abstract is accepted or rejected. So I hope most will see. I'm eager to see most accepted abstracts during this conference. Then finally, all authors will be expected to submit the PowerPoint and poster with the deadline, as you see, by 25th of May. Yeah, let me stop on this one. I'm a teacher, I'll talk too much, but thank you for listening to me. If you have any question, I'll follow on the chat. Thank you very much. Yeah, maybe if there is any question which I should answer immediately, Hezron, you can tell me. An author can submit just basically one abstract. Yeah, sure, I'll share the slide, will be shared through Hezron. Thank you but later on we can collect all questions and answer later on, and we can answer all possible questions. Good. Back to you, Dr. Sylvia. I know you now by this time you'll share some of the accepted abstracts. I've displayed accepted abstracts from previous PSK conference. Maybe hope you need me to share previously accepted abstract from ISPE conference. Yeah.
Yes, thank you very much, Dr. Ermias. You can just zoom in a little bit so that people can see. Yes, that looks very nice. Before we go through this, other things I would like to mention about preparing your abstract. One of the most common things that we see when we review abstracts is that people put their citations or references within an abstract. That is not acceptable. You can leave it in your manuscript, or if you're doing a thesis or a dissertation, that's fine. But remember, an abstract is a summary. When you're looking at the methods, if you have done studies in humans, it's always very important to cite your ethical approval, because if you have not, if you've done studies in humans and there's no ethical approval, nobody will look at that abstract, and it's likely to be rejected, because ethical issues when you're dealing with patients are very important. Always check and cross-check your abstract for typographical errors and avoid self-plagiarism. A lot of what we see again is someone has done a thesis or a dissertation, and then after that, they just go and copy-paste the abstract from the thesis or dissertation, and they just drop it and send it to the conference. Usually reviewers look for that. So avoid self-plagiarism. It's always very good to reward your abstract, because again, abstracts, if they're accepted, they're usually published in a journal. For example, for ISPE, we publish them in the journal called Pharmacoepidemiology and Safety. Again, relevance to themes and sub-themes is important. When you're writing your objectives, just write the main objective. Don't include all the specific objectives. And it's always good to prepare your document on Word, check the word count before you copy paste on the platform. And Mercy will be talking about the platform. So this is just one of, I'll just show you two abstracts that were accepted in the ISPE conference, ISPE Africa conference that took place this year, actually, in Cape Town, South Africa. So you can see that's the title. This one is called the Health-Related Quality of Life. We're looking at how do patients fare on, diabetic patients fare on, if they're on herbal versus conventional medicine, and what's their quality of life. So the authors are included. The person who is the principal, the first author, is usually one who has done the most work. And this one was for one of our PhD students. The last person is usually the most senior on the abstracts. Then you need to put your, you include your corresponding author, who's usually the first author, or you can decide amongst yourselves as a team. Then you put your affiliations and your contacts. Then when you go to the abstract itself, just scroll down, please. The background, you can see the background is very brief. It just shows you what is it about the study. So it should be very brief and very catchy. People don't like reading too much. Objective, again, one sentence can capture the main objectives. Then for the methods, the study design, number of patients, the methodology that you've used, the study site, and how you've analyzed your data very, very briefly. And then you can give your results. You give the key results, the most important results that you want people to see. And then you conclude with a concluding statement and finish with keywords. So you can see that we have summarized hundreds of pages in just one abstract. And this one was accepted by ISPI, which means it was a very high level abstract. Dr. Ermias, you can share the second one with me, please. So this one was looking at the economic impact of antimicrobial stewardship in a private hospital in Kenya. And those were the authors. And if you look again, you can actually see, first of all, if you look at the content of this abstract, you can actually see that they meet international standards. So the background, again, very brief. You just say one paragraph of what the background problem is, and then your objective, what were you wanting to achieve, and then for your methods, you give us the study design, how you collected your data, how you analyzed your data, and ethical implications. And then you give your results very briefly, give the key results that you want to present. You don't want to give everything. And then you conclude with one concluding statement. It can be a policy direction. It can be what do you want people to get from the study, and how will it impact policy, practice, and patient care. And then usually, as I presented earlier, you saw a lot of categories where your abstracts can fit. And for ISPE, and when we'll be using Oxford abstracts, you'll be clicking on the type of category that you want to, submit, so that everybody gets a chance to submit. Thank you very much. I will hand back over to Dr. Ermias, so that now we can have a demonstration of how you will submit in Oxford abstracts. Thank you very much.
Sorry,
Thank you very much, Dr. Sylvia. Yes?
Dr. Ermias, before you carry on, I want to take this opportunity to ask Joseph from Nigeria and Irene from the US to just greet us and say a few words. They're both ISPE representatives. So if you can just give them a few minutes to greet us, please. Thank you.
Good, yeah. Yes, Irene, please.
Good evening. I think it's good evening for Joseph too. Thank you all so much for coming. My name is Irene Murimi Wustel. I'm an assistant professor of pharmacoepidemiology at the Massachusetts College of Pharmacy in Boston. I've been involved with ISPI for over 10 years now, and I serve as co-chair of the African region. We are so very excited to come to Mombasa next year and to meet you all. Joseph was lead of the ISPI Abstract Committee for several years, so we'll hang around in case people have questions towards the end. Thank you.
Thank you, colleagues. Good evening. I'm Joseph. I'm a professor of clinical pharmacology from Nigeria. And like Irene has said, we've been working together. I started off with Medicines Utilization Research in African group, that's MORIA, which is a group of a lot of our colleagues from Kenya. Sylvia was part of that too. And then later we joined ISPI, and we've been working together. I usually work on the scientific committees, especially on the abstract committees of most of the conferences. So it's a pleasure to be here and looking forward to the meeting next year. Thank you.
Thank you very much, Irene and Joseph. It's a pleasure to organize this conference with ISPE. Thank you. So members who've been following some of the charts for question, there was one specific question that was asked by someone regarding submission of more than one abstract. Just we expect one author to submit only one abstract. At this point, allow me to invite Dr. Mercy to take the floor to demonstrate on how we can be able to submit the abstract using the Oxford Abstract platform. Dr. Mercy.
Good evening, everyone. Thank you for joining us today. Thank you, Dr. Ermias. I usually like to think of myself as the person who is asked to handle the fun part. So after you've done your proposal, you've done your data collection, you've analyzed it, you've done your write-up, and you have a very clean abstract, this is where I come in, so that now you're able to present this very nice abstract to us on the Oxford Abstract platform. So if you'll allow me, I'll share my screen so that I can demonstrate how you'll go about it. So just let me know when my screen is visible. Can you see my screen?
Yes, we can see, Dr.
Okay, so the plan is to present a link through which, a link that you will follow to enable you to submit your abstract through the Oxford Abstract platform. So we'll present that link in a manner that is very familiar to you, quite similar to that link that you used to register for our meeting today. So once you click on the link, just as I've done, this link should take you to a page that allows you to log into the submission portal for our event. And our event is the 44th annual PSK conference. And should you be in doubt, you can always look at the logo just to confirm that you're in the right place. So if this is your first time coming into our event, then you need to create an account. Now, I will create an account. And the creation of account is done using your standard email. It's more or less like creating an email. So you just, this will not allow me to do it. Just give me a second. So when you're on this page, if it is your first time, then you want to create an account. But if you've been here before, then you simply want to sign in. So unfortunately, it will not allow me to create an account because I had already used this email. So I will simply log in. So once you create your account, you'll be able to log in. And once you log in, this is the page that you will land on. Just give it a second to load. Sorry, just give me a minute. So once you log in, this is the page that you will land on. And from this page, then you can be able to submit your abstract. So the requirements that we have for this abstract submission is your title, and then you will go ahead and insert your abstract and further fill in some information that we need. So let me just do that. I have a sample abstract, and the author gave us permission to actually use it to demonstrate what we are doing today. So first of all, this page is looking for us to insert the title of our abstract. So we'll do that. We'll move further down, and here we gave you a summary of our expectations from your abstract. So you can quickly review this, and this is what Dr. Ermias has been talking about the whole evening, and we'll come in here and insert our abstract. So you'll pick your abstract from wherever it is you had put it. And most importantly, as you do this, is to check on your word count. So once you insert your abstract, you can see my abstract is within the word limit. We can go further down and fill in other required information. So from this portal, you'll notice that all the required information is in asterisk. So I'm the person submitting. My name is Anne Mercy. And being the person submitting, and this probably being my work, I will come to the conference and present this work. If I am not the one presenting the work, then you can put the person who will show up to present the work. If you have more than one author, then you can go ahead and put their information here. Here again, we will require your email. Please note that all these areas have asterisks. We will require the institution. Probably I'm from USIU, like Dr. Ermias, and USIU is in Nairobi. And further, USIU, the Kenya, USIU in Kenya. Should there be someone else who is involved in the work, then you can simply add an author. Now, we would like to request your permission to publish your work. And further, we'd like to confirm that all the people listed as authors are okay with this work being presented. Now, further, we want to confirm that you will be attending the conference that is scheduled for June of this year. Then you can choose whether you want to present your work either orally in a PowerPoint presentation, or whether you would love to go for a poster presentation, or if you're okay with either of these options. Further, we would like to know, this being our list of sub-themes, where exactly does your abstract fit? Maybe it fits under hospital, clinical, and radio pharmacy. And once you're done filling in this information, you can simply submit, or if you are as thorough as myself, then you want to preview. So this is how your information will look. Your submission will look. You have your title, you are the author, you are affiliated to USIU, which is in Nairobi, Kenya, and this is the abstract that you're going to present with all the necessary approvals. If you're satisfied with this, you will simply click submit. And the work will be done. So your submission, to confirm that your submission is done, you will receive a submission ID. So you can see that this submission has been identified as submission number 12. And to confirm your submission, we'll also send you an email just to show that your submission was successful. So this email will give you your submission number, and it will be the number that you'll be used to follow up with any queries that you'll have regarding your submission. Now, suppose you're someone who is, suppose maybe you are doing your work, or when you are typing this, you are doing it at night, and you realized, oh, you know what? I did this on a mouse and not on mice. So you want to change this on your abstract, okay? So you can go ahead and request to amend your abstract. Now, once you request for amendment, the document becomes, it is possible to edit your document again, okay? So maybe you wanted to put a mouse there. Maybe you wanted to write background in capital, all right? And you're done with your amendments, okay? So you can click submit again. Now, once you click submit again, it will make those corrections onto your original submission. You can see the background changed to capital letters. You can see the title changed to a mouse. And if you go to your email, you're still going to receive an email that confirms that the amendment that you made on your abstract has been received by the team. Now, suppose, let's just give it a minute. Suppose as you make your submission, yes, then let's insert our title. Maybe, sorry. So this was our title, for example. You can insert your abstract. I'll just do a brief, not the complete one, just for demonstration purposes. All right. And you say, you know, I'm sure these people know that my name is Marcy, for example. And you can say, I'm sure these people know my other name. Yeah, I'm a PSK member. And if I'm presenting an abstract, I'm sure they expect me to be the one presenting. So I'll just leave that out. Okay. And then maybe I'm still affiliated to USIU. And I assume that everyone knows USIU is in Nairobi and it's in Kenya. And maybe I don't want my work to be published. Maybe the other authors didn't give me approval, or we were waiting for one. So, you know, we don't want to check that box. We are not sure. Maybe these authors will attend, and, you know, I'd prefer a poster presentation and my work is linked to universal healthcare, for example, all right? So you can see that this submission does not meet the standards that we have set for the areas that have the asterisks or the areas that are required. So once you click submit, then we will first warn you that this submission is definitely not complete, all right? And we will show you the areas that we require you to work on again, okay? So you can choose to cancel and go back and fix those areas. But suppose you do not decide to go for that option and you continue, then we are going to receive your submission. But unfortunately, when we receive that submission will be incomplete. And when you go to your email, then you're going to receive an email that tells you that your submission is incomplete. Now, we do not have a problem with incomplete submissions. However, this submission must be completed in the appropriate way by the 2nd of April. If by the 2nd of April, then this submission is not completed accordingly, then it will be stricken out from the list of abstracts that is to be reviewed. So I know I have done a quick run, but that is just as simple as it goes. You click on the link, you go to the page, you create an account, and you are able to feed in the information, and you are able to receive it and work on it. But should there be any challenges, then I'm sure Dr. Hezron and the team have already shared this information, that you can reach us via email or via call, and we'll be able to guide you through the submission process or any other challenges that you may experience. Thank you.
Thank you very much, Dr. Mercy. It was really a wonderful presentation, and I'm sure colleagues have got the key points on how to use the Oxford abstract. I was reading across the questions, but most of them are asking for the copy of the slides. For sure, Hezron will facilitate so that we can share the slide through your emails. Thank you for that. And the other one question I saw, if you have published the abstract in another journal, is it possible to publish here too? Maybe let me give that chance instead of me responding. Dr. Sylvia, maybe can you respond to this question?
Okay, so in case you have published your abstract in a journal, you don't expect to duplicate the same abstract in another journal. If you have done work that you expect that you can present at several conferences, then you can actually subdivide which one you want for which conference, and then you create your abstract accordingly, because some people do very extensive research and they can present in multiple conferences. And then the other thing is that if you want to publish now as a manuscript in a journal, then what you can do is, again, suppose I have presented in the PSK conference, and then I want to publish in an international journal. I will have to amend the abstract so that it's slightly different from what I have presented, so that you are not presenting the same abstract and publishing the same abstract. If I have presented in, let's say I've presented in this upcoming PSK conference, and then an international journal wants my manuscript, I will always declare that this work has been presented in an international conference. So those are the two scenarios that you will get. I hope I've answered the question.
Yeah, thank you. Thank you, Dr. Sylvia. And Andrew is asking regarding the word count. I hope, Andrew, that was answered during Dr. Mercy's presentation. It doesn't count the title. However, it counts and also the names of the authors. Only word count of 350 is for the abstract body, which includes the background, the objective, the method, result, conclusion, and the keywords. Thank you. I don't see any other question. Maybe Irene, maybe if you need to add 1 or 2 pointers on the same, let me give you the floor.
I think the presentation was very comprehensive. Thank you for walking us through the portal. There is a bit of a learning curve in submitting, so we always encourage people to do it slightly in advance of the deadline, so that there's no errors at the time when the system is about to shut down. The other comment I will make is that as per ISPI guidelines, all reviews are anonymous, in the sense that we will not know who submitted it, and it is reviewed by multiple authors. I'm sure this was mentioned earlier, but we are required by ISPI to mention that. For those who are unfamiliar on what pharmacoepi is and what drug utilization is, we are hoping to see a lot of work from Kenya, because just in conversations with people I met this summer, and from knowing Sylvia for a long time, a lot of work is being done in those two areas. Maybe we are just not using the same terminology to describe them. So if you're unclear on what those two are, please reach out. If your content falls into those two groups, there might be the two groups that are slightly newer to some people and not others, because that's where we might see a lot of people from ISPI presenting on. But again, thank you so much for coming, and we look forward to seeing you in Mombasa in June.
Thank you, Irene, for that. Just there's a last one question. I know we are of time regarding what's meant by a poster presentation. Maybe let me give to Dr. Joseph. Maybe you can give the answer for this question, Dr. Joseph.
Okay, thank you very much. I think usually in conferences, you have people presenting oral presentation, and then you have people whose abstracts have been found to be good, but because usually we have limited time during presentations and during conferences for everybody to present, to make oral presentations. So some um, accepted abstracts will be categorized under poster, which means the authors will have to print it out. Just the way it was submitted, they need to print it out on a particular size of paper, which the organizers will specify. And there will be an area in the conference arena where these will be abstracts, posters arena, where arrangements will be made for people to paste their abstracts, and there will be scheduled times for abstract viewing. So people walk around, they come to the poster, which is the abstracts that have been submitted basically. They come to the poster, they ask questions about your research, and then you answer them, and people move around like that informally over the 3 or the 5 days. So for poster is also a good way of presenting, of making your work known to people. And like I said, not everybody can have oral presentation because of time. So posters are also very good experiences for researchers, especially young ones. Thank you.
Thank you very much, Dr. Joseph. And maybe
Oh,
I
if
will
I may jump in real quick, yeah, Joseph covers it. He runs our abstract team for years and knows this. If I may jump in, is there a strategic choice between picking poster, abstract, or oral? When I submit on my own projects, I usually just put either. The only reason I've seen for some people to only pick oral is that if they choose not to travel to the conference because of let's say you're funding, you're traveling from Ghana to Nairobi, and your funding says we'll only pay for transportation if you're presenting an oral presentation. In those cases, people would say oral only. But if you're open to doing either poster or oral, it's always just from experience as a faculty member, I tell my students and colleagues, we always pick either. And then if you score high enough to given an oral spot, you can get it. Or if sometimes it's not about the score, it's about the content. If the content is poster only, then you would get a poster spot. So for those who may be doing this for the first time and are not sure how to answer that question.
Great. Thank you, Dr. Irene. Yeah, so I also agree that it's better if they submit either, but it is optional, number one. Number two, during a blinded peer review assessment of your abstract is also scored, the highest point would be given the priority to do an oral abstract presentation. So this one, we shall communicate that as we move on during this process. So before I finish, let me ask one question. From all this discussion, in show of hands, how many of you are really motivated or will be ready to submit the abstract? Let me see hands. Can I count 10 hands? If I manage to count 10 to 20 hands, then we are good and we are successful. Dr. Mercy, Dr. Sylvia, I hope I can see a number of hands. Only 18. Good. So that is encouraging and motivating. Thank you, everyone. That is a good number. Yeah. So back to you, Dr. Anis, if you are here, or Dr. Hezron, you can take over now. I think it is time for us. Yeah. I don't see any more questions.
Thank you so much, Dr. Ermias. Thank you, Sylvia. Thank you, and Mercy. Thank you, Joseph and Irene, for joining us from outside of the country. Thank you for your time, and we look forward to a great conference and great collaboration in the next coming months. If we don't meet again, happy holidays and a happy new year to you. I want to hand over to Dr. Wesley Oga, who is from the Ministry of Health, who is going to make a brief presentation on the new data collection event. So Dr. Wesley, you please take the floor. Hezron, do you want to add anything?
Not really. I think we can just go ahead with Dr. Wesley's presentation.
Yeah, good evening. I think, good evening, everyone. My name is Dr. Wesley Oga. I work in the Ministry of Health in the Division of Health Informatics. And mainly today, I am to take you through, for the pharmacists who are around, the tools that are used for purposes of reporting on any of our data that we are able to deliver. So my first thing I'll be able to take you through is that if you see my screen, kindly confirm.
Yes.
Good. So we have a pharmacy reporting portal, and the pharmacy reporting portal, as you can see, the URL up there is pharmacyreporting.health.go.ke. And this is an instance specifically for pharmacy or community pharmacies that are out here that are offering family planning, and they're able to report on a number of things. And today, I think I'll be able to take you through what they're able to report. So normally when you land on this particular page, the first thing is that you need to get credentials to be able to log in. And in case you need credentials for your particular pharmacy, I'll be able to share my email at the chat side at some moment. And you just need to request and tell me which particular pharmacy you work in. If you have these tools with you, and you can be able to report. So the crucial thing is that a number of registers are printed, and I think a number of pharmacies, community pharmacy individuals have been trained on it. And at the end of the month, they're able to do a summary. And when they're doing a summary, this is where they'll be able to enter their data. So we're going to click on the far right. You can see the summary apps. Then we click data entry. So when you come to data entry, it will be able to load specifically your pharmacy. Being that I'm a national administrator of the system, I'm able to see the whole of Kenya. But you'll be able to see clearly that, for example, if I open Kenya, I open Baringo Central, and a particular ward, you can see a number of chemists here. Betty, Chemo, Chemisian, and the rest. So for you individually, you have to get your user right. You'll only see your particular pharmacy, or should I call them chemist? Allow me if I switch through both terms kindly. So for example, if it's Beltrex, you'll be able to select Beltrex, and immediately you select it on your right, the organization unit, which is your chemist, will be able to appear here. You'll see with the registration. A disclaimer here is that pharmacies that are within the system are pharmacies I got from the PPB. So you need to be a registered pharmacy for you to be able to report on this. On matters of why, I think that is for another forum, not today. So the two tools someone is able to report on. Someone is able to report the summary of the services, which is the 711 integrated summary report. Then there's something about facility contraceptive consumption and report and request. At some point, if I am right, the division of RH had requested for some funds from government, and government had decided that because of the issue of family planning, they would be able to supply some of these private chemists with family planning commodities. They could only be able to charge a small fee for delivery of that particular service, maybe for the injection or whatever amount they have to agree with. Then there's the MSF summary. So we'll just begin with the integrated summary, and then you select the period for which you're reporting. A key thing to note is that you can only report for a completed month. So for example, December will not appear here until the 1st of January 2024. If you pick November, that is what you'll be able to see. Now, key to remember is that one of the few things that we really monitor is the first new clients, people who are first ever users of contraceptive. And for this, you'll be able to enter on all these areas you're seeing here: first users of pills, combined oral contraceptives, emergency pills, all the way to male condoms and female condoms. Although I don't know if you can really get new users, but it's important as a system, as a program, to be able to know that who are the new people and who are the revisits. It's a crucial thing when you do calculating something called couple year protection, so that you're able to know how well or how bad we're doing as matters pertaining from the planning. This will be the data you'll be able to report for us. Then The next thing will be long-acting. As you can see, all the long-acting is inactive. This is because in our system and our training, the agreement was that this Implanon and the rest can only be inserted at a clinic setup or rather on a health facility setup. So this cannot be done on a walk-in person coming into the chemist. And the same thing for ICD, IUCD removal and Implanon. So the last thing is that you need to enter this data. I think in our current setup of Kenya, you are all aware of the teenage pregnancy. So the law notwithstanding, we need to know those between the ages of 10 and 14, 15 and 19, 20 and 24, and about 25 that are receiving that particular family planning service from the service delivery point. This is a crucial case, although it is one of these oxymoron we have as a country, that it is expected between 10 and 18 should not be having sex, but on the ground things are very, very different. I think you may be aware. Then the next thing you'll be able to report on is on the family contraceptive and consumption. This was to report the commodity, and I think it looks very much like the commodity tool that is used to report in our system. So this was to inform the sub-county pharmacists who are supposed to supply this chemist with this particular FP commodity, but I believe this did not manage to take over, either because of the government did not allocate the 2 billion that was to be given to this particular project, and unforeseen circumstances. That's what I can say. But this is generally what you'll be able to report on commodity, and I think most of you are familiar with it. Is where you enter the commodities that you have, the opening balance, what you received, what you dispensed, what are your losses, your adjustments in case you share out to another pharmacy or the other pharmacy lends you some, your ending balance and what you have requested. So this has yet to pick up. And the last one will be this one, malaria case summary, although this is only being piloted in Kakamega. I have to give you a disclaimer. So there are some chemists in Kakamega that are able to report malaria case summary. Now, generally, if you look at how our reporting has been in Kenya, if you look at the reports for this year, a good number of us are not doing very, very well, because if I select this data set for this year, it's not very encouraging. And you can see, for example, only 13 in Uasin Gishu have reported, 1 in Meru, 3 in Kajiado, 4. And basically most of these other counties, despite the training which we have done, have really reported within the system. So you can imagine for this year, we expected 96,420 reports. We only have 23 so far in the system. So mine is to encourage all pharmacists who are here who might have a pharmacy or other community pharmacy, and you need to report. We really need to show our service delivery, especially on matters family planning. So as such, the data is quite little, and there's literally very little I can be able to show in terms of data visualization. And unless there's a question, I would probably move forward and use the normal routine reporting so that I can show people a few visualization. Is that okay?
Yeah, that's okay. We've not received any questions so far. Dr. Wesley, I don't think we can hear you.
Sorry. I think I forgot to unmute.
Yeah,
So
but there's one question so far, but maybe you could tackle it once you're done. It's just Dr. Kenneth is asking, how does a pharmacy get MFL code?
Now, let me just respond to that very fast. The master facility list code is very essential, especially for those who are looking forward to tapping into the social health fund, which the president is launching and should be able to begin in 1st of January. the procedure is that you need to get in touch with your sub-county health records and information officer. They're usually available at the MOH. There is a pre-filled form. There's a form that they'll be able to come and carry out an inspection of your premise. And once they've been able to fill up all that form, they'll be able to upload it into the KMFL, which is the Kenya Master Health Facility List. And once that is done, you'll be able to get an MFL code. And once with an MFL code, you can now be part of the Social Health Insurance Fund, and you can be able to claim part of whatever drugs you have given someone at that particular juncture. So as I was saying, the pharmacy instance has very little data. So you'll allow me to use the hiskenya.org, which is our main routine data, to be able to show you the different visualizations that you can be able to work with. So the first thing is you need to click on the right corner where we have something called the applications. And once you search for something called data visualizer, and the data visualizer is what you'll be able to use to give you any visualization that you want to look at. Now, the landing page looks something of this sort. And the first thing is you need to be able to pick what kind of visualization you want to see. So these are all the kind of visualizations available in our system. We have a pivot table, column, stacked bar, a line graph. Each of these can be able to show your data depending on the suitability and the data that you're able or you're looking at. So allow me to start by using the pivot table. And maybe you can just try and visualize the number of skill deliveries in Kenya so that you can be able to see how the data is visualized. So the data we want to see is total skill delivery in Kenya. So I'll click on this area written data. I'll either click on the left or I can click on the right. And total delivery is usually an indicator found in a group called safe delivery. So total deliveries. Now, anytime whatever you want to visualize, you need to push it to the right here, where it becomes a selected item. This is what is available for you to visualize, and the far right is what you've been able to push. The next thing is you need to be able to pick the period. Which period do you want to see this data? A good example is that by default, the system selects the last 12 months. So I'll just let it be at that, but in case you're looking for data for a specific period, come to fixed period, and you can either pick a month, a year, yearly, or whatever, quarterly, 6 monthly, according to a financial year. Those of you who are familiar, some organization, their financial year starts in October, some start in November, or ours, in our case, starts in July. So I'll just let the last 12 months remain there. I will hide. And the next thing is I need to pick an organization unit that I want to see that particular data. So for example, if I want to see data for Kenya, I just click Kenya, and once I click update, these here are the deliveries that are happening in Kenya month by month. So you can see, for example, November, we are quite low, but I need to inform you that data is still coming in. Data is allowed to be entered until the 15th of every month. So these are basically the deliveries that have been happening in Kenya. In case I want for a different organization unit, maybe someone is interested in Homa Bay, I just click on Homa Bay, and once I click update, it should bring me that particular data as it is, as I've picked for Homa Bay. Sorry, I forgot to check Kenya. So you can see Homa Bay, generally the deliveries are about 2,600, and they're about all through the month. So once you've done this, the beauty about DHIS, it allows you to visualize this same data in a very different way. Maybe I want this data as a column graph. I just select column, click update, and I think you can all see clearly that, let me move this up here. Sure. So you can see clearly, it gives you that particular data, and it tells you Homa Bay, these are the deliveries per month and how many they've been. In case I want that data again, if again I want that data as the bar graph, I just click on bar, and I'll be able to click update, and then you can clearly see. So it will allow me to play around the different dimensions. If I want it as a line graph, I just click line, and you can see that data is visualized in a line graph. In case I want this data maybe for purposes of downloading, to use them in an abstract or whatever format, you can see up here the summary you can download. Once you click download, it will ask you which format you want to download it, either as an image or as a PDF, and then that will allow you to be able to download it. Different visualization options go on. You can decide you want it as an area. Again, it will give you that particular one. So it's you getting to know what is the suitability or what is the audience you're working with and how particular that data you want to see. I think I've been able to show you clearly that all this, if you want it as a pie chart, just do the same. And it will just give you one because a pie chart is good for only one time period. And in case you need it as I think I've gone through most of it. So probably what I would like us to see is, in case we have this data and we want to see it in a year by year. So let's select, for example, a period. We want to see last year and this year, how does that particular data appear? We will be able to pick 2022 and 2023. So we hide and then we pick the option, but we want to see this data year over year. And once we update, it should be able to give a good comparison like that. So you can see generally 2022, the deliveries were quite low in Homa Bay. They have gone up this year. They're quite high, as you can see. In case I want to see for Kenya, I'll just come back here, remove the Homa Bay.
Dr. Wesley, I think the screen is frozen. I don't know if you're on a different page right now or still the same. Yeah, I think it's now clear.
Okay. I think I made a mistake and paused the share. So what I was saying is that the system allows you to be able to do a year over year and compare different years. So for this particular one, I've said just look at the deliveries for Kenya, where 2023 is in green and 2022 is in blue. And so you can be able to clearly see. I think generally looking at it, you can see, I don't know if this year we're giving birth more or less, but that gives you generally a trend of what is happening. So all this visualization will be dependent on the kind of data you have and which your audience is for which you're trying to look at. I believe this is the much I can do for the moment, being that it would have been more easier if we had more pharmacy data. What I tend to have now is the team data. Thank you.
All right, thank you. Thank you so much, Dr. Wesley, for taking us through that. For participants, do you have any other questions that you'd like addressed? So I'm seeing Dr. Farida is asking if you could kindly repeat on how to get the MFL code. And then there's also a question asking, how do we move from the bar graph to the line graph? Dr. Wesley, maybe you could tackle those two.
Good. So I will go again through the MFL code. Now the work of giving an MFL code is devolved. So it happens at the sub-county. So within the sub-county, we have a sub-county health records and information officer. And this sub-county health record and information officer is the one mandated to adding of facilities for them to get an MFL code. So you will approach your sub-county MOH, be shown where the health record sits, and you'll be able to fill a form within them, requesting them that to come and inspect your facility for purposes of getting an MFL code. So we have already prepared checklists, which a team from the sub-county will come, and together they'll be able to assess your facility, your staff, and the kind of stuff you have, what is available, your infrastructure, and all those things. And once they have been able to capture them, they'll come and load them within the system. The county HRIO will be able to validate, and someone within the national, depending on the region, like I personally cover Western region, I'll be able to approve. And once the approval has gone through, you'll be able to get an MFL code. And this is quite crucial for those who want to look forward into tapping into the social health insurance fund. In case you do not have an MFL code, you'll not be able to get your rebates back because you're not recognized as a health facility or a health registry as someone delivering health. Now, the other one I've been asked is, I believe my screen is still being shown.
Yes, I think it's because that part is where the screen was frozen when you are shifting from the bar graph to the line graph.
So what I was saying is that once you click here, whichever visualization you might want, all you need is to select that particular visualization. For example, let me say I want to compare this as column. I select the column and I just click update. So, sorry, I was working online, but generally that is it. You pick whatever visualization you would want to see this particular data. And once you picked it, like this one, then you update, the system will automatically change whatever data you have selected, whatever visualization that you want to see. What is important is to get to know which visualization is good, which particular data. A good example is, as I said, pie charts are only good if you are doing a cross-section of data at a particular point and juncture. They will not be able to cover for time. Bar graphs and column graphs are very good for data that is covering a period of time. But the only challenge would be if some of the data tends to be very, very small. So it will only appear as a very small thing down on the bar graph, and it will not be able to give a very good representation of sharing. Thank you.
Right, thank you for that. I see we have a couple of questions that have just come in from Dr. Lucy, who's asking what kind of pharmacy data is being collected apart from FP and malaria?
Now, at the moment, those are the two programs that have worked towards ensuring that they get data that is collected from the community pharmacy. The other programs have not been able to do it. And so we await once they develop tools and they really want that data collected from the pharmacy, community pharmacy, we as a health management information system are more than ready to customize the tools and make them able to report within the system. So at the moment, the only proposal we've got is from RH, reproductive health, and the malaria. Thank you.
All right, thank you for that. And then the other question is from Dr. Anita, who's asking what aspects of decision making is affected by the lack of data and how does it impact care?
Now, a good example I'll give you is that at the moment, our reporting for family planning is very poor because as it is in Kenya, our first point of care for most of the family planning, especially for the age that is very active, tends to be the pharmacy, for the community pharmacy. I think I don't need to belabor the point. All of you are familiar with how much P2 we sell during every Monday morning or every Friday evening, or whatever time. So as such, what is captured as our need for family planning tends to be very big. Whereas in the real sense is that we have a good number of our people accessing and getting this family planning, only that we do not have the data to show it that there is care being given or the family planning uptake is high, only that it's being done at the pharmacy level. So that means generally as we are planning as a country, we're planning with even say half the data. And even when we're doing our modeling and everything, we do not, our data is not rich enough to be able to give us a good perspective of what we're going to do or what is happening. And that is becoming a very big issue. And that's why, as you've heard, our president has said, universal healthcare from 1st of January, everything will be free. So the issue is that cost implication, if that is what is making people not report or not go to health facility, should be a great turn so that we'll be able to see data coming in and will be able to help us as a country plan very, very well. I hope that answers them.
Yes, that answers. Thank you so much. Maybe just the last one is someone is asking, is the data visualization limited by rights issued to the person or not? I believe he's speaking about this slide.
Yeah. I think one of the few things I've realized is that most of the time when the rights are given at the lower level, they're not able to be given rights to see the whole of Kenya. So the data visualization is available for every user. The only challenge is if you have access to seeing Kenya. Because sometimes when you're given rights by the sub-county HRIO, they tend to limit you within your own sub-county, and that becomes a very, very big challenge. But in case you want to see Kenya, you can just do a mail. I'll be able to share my mail at the live box so that anybody who needs assistance to access or getting a higher view of the visualizer, I can be able to adjust your viewing rate so that you can be able to see Kenya. One thing we're encouraging people is that you should be able to view every data in everywhere in Kenya so that you can also see what is happening across the country, and you can compare yourself and see if you're doing very well or not.
All right, thank you so much. I think all the questions have been answered. So I see a comment from Dr. Sylvia Opanga, who says we'd love to have this presented at the conference. So maybe, Dr. Wesley, that's something you could consider.
Sure,
next
I
year.
would consider that. There's no problem. I think that's now me for my homework. Thank you.
All right, thank you so much. Thank you so much for the presentation and the support you've continuously given PSK during this family planning project. So we have an announcement that I'd like to make. We are currently looking for pharmacies that are being run by pharmacists in Nairobi, Kiambu, Kajiado, Narok, Meru, Kisii, Kisumu, Nakuru, and Uasin Gishu for a project. So if you're currently running a pharmacy in these regions, kindly send your contact details to the PSK office, and then we'll reach out to you. And some of the information that we'll need is the name of the pharmacy, the phone number, name of the pharmacist, the registration number and email. And of course, one has to be a member of PSK. So kindly take note of that. Also reach out to your colleagues and let them know about that. So as we close, I'd like to welcome Dr. Mungoma to just maybe give some comments about this second session that we've just had. Dr. Mungoma, if you can hear me. Dr. Mungoma. All right, I think
yeah, you can hear me now?
Yes, you can hear you.
Yeah, thank you. I think there was a change there from whatever I was to a panelist. Yeah, but I've been very attentive the whole evening, and one, I just want to say thank you so much for the earlier presentation from the formidable team that are putting the whole conference together. I think they're really doing a good job, and we really need to support them and make sure that this is a good quality conference, keeping in mind that it's an international conference as well. I really want to thank again Dr. Wesley from the Ministry of Health for his continuous support and his involvement in ensuring that pharmacies continue to appreciate the value of reporting and the power of data. I know that our focus on family planning, however, as was mentioned there, that other commodities and other programs are also coming in, like malaria. So it's not just about FP when it comes to data visualization, but it's all about how the private sector contributes towards the whole reporting and supporting, focusing, supporting, the whole supply chain management in the country. The private sector is a very, very powerful sector, and it's something that government continues to appreciate. Over and above that, again, I also want to encourage everyone to think about publishing in the PJK, that's the Pharmaceutical Journal of Kenya. I know there are a lot of graduates out there. There are people doing postgraduates. There are people collecting data where they work, whether it's private pharmacies or even in research institutions. You could put that data together, come up with a manuscript and publish in the PJK. You can get further details about this from the office. Besides that, again, thank you so much, Hezron, and the good work that you continue doing in holding these webinars. Thank you.
All right. Thank you so much, Dr. Mungoma. So as we close, I'd like to just remind you, kindly ensure that you subscribe to this event on the PPB portal. The name of the event is Abstract 101. So you can use that keyword, Abstract 101, and you should be able to get that event on the PPB portal. And also just a reminder that we have the tree planting, Zumba, and our nature walk activity this weekend. So for those who would like to join us, kindly ensure that you fill in the form that has been circulated. So I think this is where we'll end. Thank you all for joining and for all the speakers for this session today. Have a good evening.